Hi, I'm Dr. Hamish Urquhart and I'm a specialist colorectal surgeon at St Vincent's Private Hospital. In this video, I'm going to discuss fecal incontinence and the important role that we play as clinicians to recognise and treat this condition. Fecal incontinence is surprisingly common, with the majority of sufferers not seeking medical attention or not bringing it up with their GP. Some studies suggest up to 18% of the population suffers from some degree of incontinence. The condition largely remains undiagnosed and can have a debilitating effect on the physical and mental well-being of our patients. As practitioners, the most important thing we can do is address the stigma of fecal incontinence. When we're with our patients, we need to normalise this and create an environment that patients feel comfortable to disclose. For you as a GP, simply asking about a patient's control of their bowels is often enough to get the dialogue started. In any patient over the age of 40, I urge you to ask, have you had any issues with incontinence? We know this condition affects the young, so we shouldn't reserve questioning for the elderly only. In addition, anyone who has had a change in bowel habit or issues affecting their pelvic floor should be considered for questioning. In patients who have experienced a complex vaginal delivery, their risk of incontinence is increased and hence should be inquired upon.
And it's important to note that incontinence may come on early or sometimes years down the track following such a childbirth. If any patients are struggling with incontinence, we as colorectal surgeons are happy to see them to investigate the cause of the problem and work out how to treat it. Following this referral, we will take an extensive history including all the details of the patient's bowel function and also their risks of conditions which may affect continence. There are multiple investigations that we as colorectal surgeons will organise. These often include a colonoscopy, pressure manometry testing of the anal canal, pelvic nerve testing, and also ultrasound of the pelvic floor and anal sphincter musculature. Based on this, we compile all the information to work out the best way to treat the condition. What treatments for fecal incontinence? Sometimes simple lifestyle modifications or medications can help control the severity of symptoms. We can also arrange pelvic floor biofeedback programs and pelvic floor physiotherapy, which can help the condition. Occasionally surgery is required, and this can range from repair of the sphincters, bulking up of the sphincters, or other very specialised surgeries where we place a pacemaker into the sacral spinal nerves, helping coordinate bowel function and continence. Together we can help these patients. There are multiple treatment options, and while it may be a difficult topic to bring up, we must stress that fecal incontinence is treatable.